Hello friends, I am Dr. Abid from Kochi in India. I am here to talk about a quality improvement project I did in my hospital. My hospital Aster Medcity is a coronary center in South India. There is no conflict of interest and ethics approval was not required for my project. The work was done in endocrinology department of Aster Medcity, Kochi. The team consisted of consultant endocrinologist, chief nursing officer, nurse managers, nursing officers, nursing educators, staff nurses, clinical pharmacists. Insulin is a high alert medication in our hospital. Often it is handled casually. The main error noticed is improper dosage delivery of insulin despite of complete prescription of insulin. The insulin medication errors are not reported by the nursing heads. Sliding scale insulin charts of all inpatients receiving endocrinology consultation for insulin titration was secretly audited consecutively for 5 working days based on different wards. Total complaints was only 64% and the data of least complaints depending on wards was reported to the chief nursing officer. CNO in turn transferred the data to the assigned nurse managers and nursing officers of different wards. This led to the education about proper dosage calculation of insulin and its importance in better clinical outcome to the patient, to all the staff nurses, especially freshers. The nurse managers and nursing officers were put into active monitoring in their wards in all shifts. Casual delivery of insulin will be changed. This change will be implemented by proper awareness and education at all levels of nursing service and by strict and regular monitoring. All the doctors will be advised for insulin raising without fail if any error in insulin dosage has been noticed. All the clinical pharmacists of different departments will be advised to monitor complaints in their respective departments. After the audit, rigorous education of insulin complaints was given among the nurses. The defaulters were reported and individually educated. This gave an opportunity to receive feedbacks from the staffs. Their doubts were clarified and the importance of insulin complaints were reinforced among the other nurses. The nursing educators were advised to make sure that all newly recruited staffs are familiar with in-hospital insulin sliding scale chart, and the same was added to the competency assessment sheet of the nursing staff. A total of 484 readings of insulin prescriptions were taken during the audit and re-audit. Chi-square test was used to analyze the data. Complaints in audit is 64% and complaints in re-audit is 80%. So the difference is 24%. P-value is less than 0.05, which is significant. Thus, there is a significant difference between audit group and re-audit group. Early control of blood sugars were attained, which led to better clinical outcomes and shorter hospital stay, which in turn led to less mortality loss and decreased chances of hospital-acquired infections. Educating and creating awareness to a large number of nurses was the problem encountered during the process of change. The lessons we learned from the project are that we should ensure education and competency assessment of nursing staff. We should ensure strong implementation of safe medication practice. We should review and do monitoring of drugs, especially high alert medications. And finally, we should develop culture of blame-free environment for reporting incidents. Bolus insulin delivery complaints is much low than we expect, but at the same time, improving compliance is an easier task than we expect. Thank you.